My name is Hankje Escher. I'm a pediatric gastroenterologist from Rotterdam, the Netherlands. I am a member of ESPGHAN and I am very proud and honored to present the Healthcare Transitions campaign. The transition campaign is very important for all of us because all of us have to deal with children who have either congenital disease or chronic disease, and it doesn't stop at the age of 18. So we all have to be aware of how to prepare our youngsters and their parents for this step to the adult healthcare system. So when we think of transitional care, you have to keep in mind there are different types of patients that need different kind of attention. So for instance, the backseat patient, just imagine the teenager sitting in the back of the car, listening to the parents. These are the kinds of patients who are a little bit, they don't really mind what's going on. They let their parents do the work, and these are the patients that you really have to be aware of, that they are at risk of dropping out after the transfer of care.
Hi, my name's Priya. I'm 25 years old, and when I was 14, I was diagnosed with primary sclerosing cholangitis. So when I was diagnosed, because I was 14, I was right in the window for transition to get started immediately. So I guess in that sense, my transition journey wasn't conventional, since my healthcare team knew that within the next few years they would transfer me to adult services. And because of that, right from the start, the doctors always made sure that I was an active participant in my own care. Whilst my parents were there and they were always involved and there to support me, questions were always asked to me. So it was, how was I feeling? What were my symptoms? What medicines am I on? What dose am I taking? And all of that sort of built up my skill set. I knew what to expect from these appointments and procedures and ward rounds.
So transitional care ideally should be a structured program, like a stepwise program. And for instance, there are certain interventions that should be part of the structured program. One intervention is that you sit down with your patient together with the adult team member, either the nurse or the doctor, and talk about the differences in care. So you do that already 1 or 2 years before the transfer of care. So you do a joint visit to talk about the differences and what to expect. Then second, you need a coordinator. You need a coordinator who helps take the patient and the parent by the hand and moves along with the patient and the parents from pediatric to adult healthcare.
When I was nearing the age of transition, I was around 17. My pediatric team facilitated a tour of the adult hospital, and I was accompanied by my specialist transition nurse and my youth worker, where they made a connection with the adult team on my behalf. I was introduced to all of the faces that would be looking after me after 18, and the ward that I would be possibly staying in, and all of the facilities that I might be using when I was older. It was quite daunting to change hospitals after being with the paediatric team for so long, all of these familiar faces. So having that time to bridge a connection was really helpful and made the whole process a lot less stressful.
There are many mistakes that you can make during transitional care if you don't know about the importance of some aspects. So one of the most important things is that you need to be aware that transition is not only medical transition, it's a whole person that is going to move from one healthcare system to the other. So you have to be aware of also the emotional impact, the social impact, the influence of peers, the influence of the parents.
So when I was 17, my condition deteriorated a bit more rapidly, and my healthcare team saw that I would need a transplant very soon. At that time, the consultant in charge of my case was out of the country, and so a different doctor had to take over. Whilst I had a transition plan in place that myself and my parents had been aware of, this new doctor had looked at how I was in that moment and decided that I needed to be transferred to adult services right then and there. That was quite stressful because we'd had this procedure in place, and all that kind of went out the window.
Another thing is that it's not only one doctor who organizes transfer of care. You almost need a whole village to transfer a youngster to adult care. You need a nurse, you need a coordinator, you probably need a social worker. And I think most important is you need to have a good relation with the adult healthcare provider. So this is actually the person who will do half of the work.
I'm really grateful to my transition team for having made the process so seamless. I'm still in contact with my transition nurse. She always checks in with me every time I'm in the hospital, and I really wish that all patients would have the opportunity to have such a great experience when transitioning.
You don't have to invent your own program. There is a lot of resource material available on the website. Thank you for getting involved in this campaign, and thank you for watching.